very much for your patience whilst we sorted out this small technical challenge. Thank you very much. And today, once again, we are here live with a weekend health talk. I am Dr. Albert Sedun here, your host. We do this weekly to help reduce the high level of misinformation when it comes to health issues on social media. And today we have an amazing guest speaker. She's a specialist dental surgeon at the Kolebu Teaching Hospital. All right. She is Dr. Mrs. Christiana Ekia Kwapon Nyakon. Going to talk to us about halitosis, that is bad breath. We need to know what causes it and how to go about it. And in addition, she's going to share with us how to brush our teeth the scientific way, the best way. Doc, over to you.
Oh, thank you so much. Thank you so much for this opportunity. I'm so sorry. I'm so sorry for all the technical wahala. It's something small with my laptop, but all the same, let's go on. Let's continue. So today I'm going to talk about bad breath. The scientific name is halitosis. I'm going to tell you all you need to know. And as Dr. Sedon here mentioned earlier on, I'm Dr. Mrs. Christiana Kwapon from Kolebu Teaching Hospital at your service this afternoon. So halitosis is basically bad breath, and it is one of the most challenging problems we have. So in our community, people don't know how to tell their friends they have it, and some have it and they don't even know they have it. And some don't have it and they think they have it. So they don't even want to speak in public. They don't know how to even treat or manage it, who to see and what to do to handle. They use all sorts of concoctions and they still don't get the right solution to their problems. So my outline is going to be a very short presentation, and it will move from introduction to classification, etiology. Then we go to how to diagnose and the preventive measures, then the treatment needs, management, and then we conclude. So basically, bad breath is when a noticeably unpleasant odor is believed to be emanating from the breath, regardless of whether it's coming from the mouth or other sources. So wherever it's coming from, it will come from different places, but the problem is you have bad breath and we can smell something in your breath. So it could be coming from your exhaled air from your nostrils or your mouth directly. It could originate from the body, but it could be coming through your mouth. So people might think it's your mouth that is smelling. And it causes a lot of anxiety in the affected patient and usually decreases their self-esteem and causes depression in some of our patients. So it's, as I said earlier on, it's also known as halitosis. And halitosis comes from two different words in Latin, which is halitus and osis. So we have the breath, which is halitus, and then we have a disease, which is osis. So together we have halitosis. And it shouldn't be confused with a temporary oral odor. So sometimes you take certain kinds of foods like onions and ginger and things, and you tend to have this mouth odor. No, that is not halitosis. Those ones are just temporary. So when you brush, it gets better. Or sometimes you take alcohol and yes, you blow fuse. So you can smell it in their breath. Yes, those ones are just temporary and they are not halitosis. But this is usually a permanent breath smell from in your breath. That's one can smell it every time. And usually when you wake up in the morning, because of the activity of the bacteria in our mouth, which whether we like it or not, we have them in our mouth as a normal flora. We tend to have this sort of smell emanating from our breath. So those ones who are temporary ones and not halitosis. So let's not confuse it with that. So for the classification, we have genuine halitosis and we have delusional halitosis. So for the genuine halitosis, so this is a picture, an illustration showing the different areas that we could have it originating from. And one thing I always tell my colleagues and patients is that when you have halitosis, you don't go ahead looking at the feet or looking at the tummy when you haven't searched through the mouth. The thing is, when you smell something awful around you, you first inspect your body before you move out to someone's house to go and ask if the smell is coming from there. Yes. So the mouth is 90% of the time, what we smell comes from the mouth and its surrounding tissue. So you don't go attacking the liver, you don't go attacking the respiratory organs, you don't go attacking the kidneys, though it will come from them. It's usually 10% of the time that you have its causes coming from them. Most often than not, the respiratory system could have much more parts to play, but those areas are still linked to the oral cavity. So we still say it's coming from the oral cavity. So if you have bad breath, I would advise that you come to the dentist, we check everything. And then when we know that it's genuine halitosis, but it's not coming from your mouth, the source is probably from gastroesophageal reflux disease, or it's coming from a respiratory mass, or it's coming from a respiratory mass, or it's coming from sinusitis or something, then we refer you to see the specialists involved. Sometimes we manage them ourselves too. So for the oral causes, so for the genuine halitosis, we have physiological halitosis. So that's what I spoke about earlier on. From the morning breath odor, we have some patients taking tobacco. We have certain foods and certain medications which tend to give temporary halitosis. And those ones we just, when they come and we know it's coming from there, we just advise accordingly, and then we move on and we review. If it's not there, then we know that it was actually a physiological thing and not because patient has a halitosis. Then the pathological halitosis, the intraoral origin, as I spoke about, is 90% of the time. So usually you have plaque, you have a grossly carious tooth, you have accumulated a lot of calculus. Sometimes you brush your teeth and you forget to clean your tongue. So you have a tongue coating coated with decayed food particles, stains and things on it. And these plaque and tartar smells a lot. So you if you even forget to brush your teeth in the morning and around 12, you feel some roughness on your teeth, just take a spatula or something to scrape on the surface, or dental floss, just scrape it, take off the soft thing and try smelling it. It smells like decayed food. And sometimes you have dental lapses in your mouth. And another thing is some patients have very deep tonsillar crypts. So these crypts tend to have tonsilolate food particles accumulating inside, and then you have these tonsilolates form. And all these go on to release the volatile sulfur compounds. So the smell we smell outside is actually decayed amino acids and then volatile sulfur compounds that gives that smell. I don't want to go into the more science bit. I just want us to know that these are the sources we get the smell from. And then the pseudohalitosis are apparently healthy. While stalking, noticed a friend covering the nose or something, so probably thinks he or she has halitosis. And then the halitophobia patients are referred to as delusional halitosis. They exaggerate the fear of having halitosis, so they come to us saying they have it when genuinely they don't have it. Yes, and one thing we've noticed in our profession in dental clinic is those who would walk to us and say, "Doctor, I have bad breath," are patients with either physiological halitosis or apparently healthy individuals who, due to one person's reaction, probably think they have it. And then those with halitophobia, so they don't have it, but they think they do have it. But so for they are those who would walk to you, but those who have the pathological halitosis, they will usually come whispering into your ears, "Oh, doctor, I have a decayed tooth here." Then you move closer and you're like, "No, this is not just it. This is it." So you start probing into it and you get to know that they actually came because of the bad breath, but they are attacking something small in their mouth with it. So this is the problem we have in our system. So this is basically 90% of genuine halitosis cases originate from the mouth itself, and that's what we call intraoral halitosis or the oral malodor. The common causes are the biofilm on the back of the tongue or the other areas of the mouth due to poor oral hygiene, and then the volatile sulfur compounds are associated with the malodor level. So the higher your sulfur compounds, when we test for these ones during diagnosis, we get to know the level that you have. So we have those with mild, moderate, severe, and the dangerous ones. Then the other parts of the mouth also contributes to the overall odor, but usually the commonest part is the tongue and then the subgingival areas, and sometimes you have impacted food cavities in your teeth that you haven't filled, then you have food particles staying in. Then sometimes we have diseases, infections attacking the oral cavity. So herpes simplex infection, HPV infection, Kaposi sarcoma, HIV, hairy tongue, they all trap food, and all these things causes lesions in the mouth that gives this oral malodor. So this is just a picture showing. Sorry, please. One thing I forgot to talk about is patients with prosthesis. So we give dentures, we give some patients have braces on, and we teach anytime we give a patient a prosthesis, we tend to teach them how to clean them. The reason being that when you don't go by these rules, you have food particles trapping under them, and you have it staining them. And when they get decayed and they start releasing these compounds, it starts smelling, and it really smells bad. So you can see from the diagram, we have a pair of dentures, and it looks awful, and it has a lot of the coated tongue. Then you see the plaque and calculus, you see a patient with crown and the whole gum and things. So these ones, before they even open their mouth, you can actually smell it from a distance from them. It smells very bad. And the extra oral causes, the 10% is usually from the gastrointestinal diseases such as gastroesophageal reflux disease, sometimes malignancies in the liver, and some other places too will cause the malodor. And then the lungs to the respiratory tract, patients with chronic sinusitis. These are patients who will walk to you. Some of our colleagues, our nurses, our doctors, very fine people would come in with this. Chronic sinusitis is one common thing we see, and they usually come with halitosis because all the maxillary sinuses are actually linked to the oral cavity and then the nostrils too. So when you see such patients, we see them, if it's just straightforward or an acute on chronic, we tend to manage it. But when it's a little more severe, we see our ENT specialist, and then we manage hand in hand with them. Then the tonsillitis, I spoke about the tonsilolid. So when you see your mouth, I'll show you a picture I have a picture of it. Then we have the stomach, intestines, liver, and kidney. Or a number of systemic diseases affect them, but this is just 10% of the population. So 90% of the time, that's an average of 90% of the time is coming from the mouth. So please, if you have halitosis, don't go attacking your system or don't start diagnosing yourself. It is just 10% of the time. And usually after we've seen and cleaned the mouth, if it still persists or we know there's this chronic disease and this, then we start linking things to get the exact cause. So this is also the extraoral causes. So we have the lung abscesses and bronchiectasis, tonsillitis, rhinitis, sinusitis. We have liver failure would give you this fishy smell. Then the renal failure, you have smell of the ammonia. Then the strongly smelling foods, which are usually a temporary thing. So we advise the patient to stop. Then we have the gastritis and the ulcers too, causing their own thing. Then this is the tonsilolate I spoke about. So this is quite common in people. And sometimes if you don't have tonsillitis, you open and you see this whitish spot there. There's no pain, but you feel a little uneasy. You feel there's something in your soft palate. Sometimes I have it. I have friends who have it, and they will tell you there's something coming from my throat. I try pulse brushing, it just dropped. If you crush the thing in the picture, the mouth, the one on the right hand side, if you it's on my right hand side, I'm sure it will be to you to be on the left hand side in the palm, that small creamish thing. If you crush it and you take it to your nose, it really smells. So if you have it stuck there, it brings this malodor, and you might not understand why you're having it. Some patients would even run to the ENT specialist thinking it's a tumor or something, but it's just food debris trapped in the tonsillar crypts, and they will come out. Eventually, they come out. So these could also cause halitosis. So with diagnosis, usually for the diagnosis, we have the subjective test and the objective test. So for the subjective test, the patient we have the cap breath. So we'll tell you to cover your nose and your mouth, and then you breathe into it. And you can actually smell from your breath. Then we have the wrist lick test. So you just lick your wrist, and then you take it like 5 cm away, and after some few minutes, you can actually smell it even at a distance that your saliva and breath. So if you breathe on that area or you lick that side and you take it a distance away, you can still smell it after some time. And then we have the spoon test. The spoon test is also like that. You scrape the tongue or you just put it in your mouth, on your mouth, you breathe into it, or you smell it after some time. You can see. Then the dental floss, you pass the floss on the surface of the tooth, usually the interdental area. Then you pass it on the surface of the tooth and smell it. You can actually smell that no, this is not the ordinary smell from the mouth. This is not something I ate, but it's something a bad odor coming from my mouth. Then for the objective test, we usually do them in the clinic to prove it, but most often than not, we do the tongue coating index. So we inspect, and then organoleptic measurements, we tend to smell from afar. The commonest one we do is the Gapoha test. So we tell the patient to mention the word Gapoha. Then when they mention, we start chatting. So when you come, we will chat with you to make you comfortable. And please, one thing I want everyone to know is that for dentists, I have I have seen a lot of cases of halitosis. So whatever you are bringing to us isn't so strange. It's not something that hasn't happened before. So don't stay home and think, oh, I can't, or feel shy. If you can't even say anything, just come and tell us we want to come for a dental checkup. If it's there, we will pick it up. We will tell you about it, and we'll start cleaning, we'll start investigating, and then we'll sort it out for you. So always come to us. It is our job. That is what we do. And it's no matter how bad it smells to everyone, we are okay with it. Our noses adapted to it, and they will smell it and treat it. That is what we do. Then, so these are a few preventive measures to take to prevent one from getting halitosis. So, as I said earlier on, you visit your regular visits to your dentist. So, ideally, you do 6 monthly cleaning of your mouth. If you don't have anything, you've never had any pain or anything, don't wait to have pain from a toothache before going, a cavity before going. Just clean your mouth as visit the dentist for a checkup. If nothing at all, it's the gateway to your body. So on your birthday, as a birthday gift to yourself, we do a lot of things on our birthday. We do so many things. I don't want to mention them. Add a self checkup. Go and have a thorough examination. Clean your mouth. Give yourself good breath, and then just lie in your bed. Cup your mouth with your nose and breathe into it, and know that you are halitosis free. Then good oral hygiene, which includes flossing regularly. So most of us do the brushing, but we forget to floss. So usually, especially in the evening after brushing, you floss in between the teeth regularly. And this flossing is mainly for patients with tight interdental space. So some patients have open spaces. They don't even have their teeth are not so together, especially the front teeth. So you just floss the back ones, the posteriors, but floss in between your teeth. And anytime you brush your teeth, make sure you scrap your tongue. You use a tongue scraper. You just use the brush to clean the tongue. If you don't have it, you don't have to buy anything, ordinary thing, but clean it. Let's teach our little ones. Let it be part of them that when we brush their teeth and we forget to clean it for them, they will know that, hey, no, I have to do this. They will remind you, Mommy, my tongue, you forgot to clean it. And then let's limit the intake of these strong odor spices. So usually we like our onions and garlic. If you chew them raw, especially early morning, and maybe you have some sort of plaque and things in your mouth, these strong other spices joins it. It's like spraying a smelly body. So it adds up to the already mal odor in the oral cavity, and it's bad when you sit in a public transport and you breathe, you give this smell, you cause a lot of trouble. So let's limit the intake. We are not saying don't take your onions, don't take your spices, don't take your garlic and things, but when you take them, brush your teeth after. Is one thing I always tell my patients. Just brush after and get it off. If you are outside and you can't do the brushing, get a sugar-free gum and then chew it to just freshen up. You can get some oral rinse to rinse your lozenges and things to take, which will help. Then limit the intake of sugar and caffeine. The intake of sugar, ideally, it's we should just limit it in general. So these bacteria tend to act on it, and it causes. Last time I spoke about how it decays our teeth, and then we have a lot of cavities in our mouth. You have rampant caries. You don't have money to treat them. You get abscesses and things, and all these contributes to the smell. And one thing there are some patients who genuinely don't love talking. Me, I love talking, but they don't talk. So especially, I'm not attacking my men, but especially some males just don't talk. They could sit in the office the whole time, do their thing on their computer and not talk at all. So when you have this, let's have in mind that when you keep water in a bottle or even an empty bottle, when you close it for a very long time and you open it, it smells. It smells a little. It's where chai. Yes. If you leave your house for some time, you close all your windows and you come back and you open it, you have this smell coming from it, emanating from it. Yes. So if you are that kind of person and you just don't like talking, just get a sugar-free gram. If don't close it for too long, just get a sugar. I'm saying sugar-free because the more you take these sugary ones, you introduce a lot of sugar into your system. But the sugar-free ones are okay for our health too. So you chew it and then you constantly aerate your oral cavity. So it takes out the a few volatile compounds released, it takes them out and then it brings in fresh air. And that is how you live freely with your people. Then you eat healthy. That is very good for us. You eat healthy, take a lot of vegetables, and then drink lots of water. So just like the sugar-free gum, and talk it, chewing it and aerating the mouth, the water tends to rinse out any food debris in your mouth. Anytime you take in a sugary diet or you take in sweet, let water be the last thing in your mouth. Don't have food debris in your mouth to allow them to decay and cause the smell, cause joints stick to the teeth, causing these smelly biofilm on the teeth. So we move on to the management. So as I spoke earlier on, for the management, we tend to deal with the intraoral bit first. And then when we realize from the start, if we get to know that it's coming from, it's a systemic something, we just do our usual professional scaling and polishing. And then one thing I like about us is as colleagues, when I see you as a patient and you have this and I have to refer, usually I would talk one on one to one of my colleagues one on one. So I talk to them and then I get you the appointment to see the specialist involved. So if it's coming from the respiratory system, we get you a respiratory physician to see. We get you a special gastro specialist to see. So you clean your tongue, you do effective toothbrushing, interdental cleaning, then the professional scaling and polishing done in our area. And then that's the mechanical bit. Then we use certain chemicals to reduce the oral microbial load. So whatever chemical it is, I know there are a lot of chemicals on the market now. Yes, the economy is hard. People are trying to get a lot of things, but please don't use your money to buy something that will cause you more problems. So we want something with clohexidine. We want something with clohexidine, 0.2% clohexidine. That is what we want you to have. Yes. So if you take a little time to read, if you can't read, kindly get your little one or get someone, a professional person to check and then, or get someone to prescribe it for you and buy from a reliable source. There are lots of oils they sell in public transport which don't help, they only cause problems. So you get your fluoride, you get your triclosan, you get your essential oils, and then your oxidizing lozenges. I put this down because personally, Cosodel mouthwash has really worked for most of my patients with halitosis. So I don't joke with it. Whatever it is, I give it, especially patients with sinusitis, after giving them the antibiotics and teaching them how to clean for very good. I prescribe the Cosodel mouthwash, and sometimes I have to call them and ask them, won't you come for review? Because they are so fine that they don't even come back for their reviews. Then whilst managing too, there are some patients we advise they get mouth spray, rinses, the sugar-free gums and things because they take certain medications, and even most of our alcoholics would get bay leaves or something after they take their alcohol. First, it used to be PK, so they get PK chewing gum to put in their mouth after taking alcohol to chew, just give a fresh smell, fresh breath. So we advise that you get this. And then most patients with halitosis never know they have it. So they they never know they have it, and even when you start managing, they 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 don't believe they are getting better. So we advise that you, for reviews, you come with a confidant. That is, you come with either your spouse or someone you really trust. So the person would confirm to you that, oh, this smell that was there earlier on isn't there. It's improving. So sometimes your spouses, maybe your husband or your wife noticed, they told you about it, came with you, and then when we start the treatment, we advise that you have someone you can trust to also confirm that you can, because most patients would, even after the treatment, they might not, they don't, the self-esteem isn't there. They don't want to speak in public. They don't want to get so close when they are speaking to their friends and things because of it. And the more you keep the mouth closed, the worse it gets. So, as I spoke earlier on, the respiratory specialist, the gastro physician, and then the ENT, the ear, nose, throat specialist, we usually work hand in hand with them, because it's almost always a problem with the mouth or the throat or the soft palate or the nostrils. So we work with them. A few of the cases we refer to the clinical psychologist. We make you see them because there are some patients, after doing everything, they still think they have halitosis. And patients with halitophobia and pseudo-halitosis, some of them, whatever you say, they think they have it. So we get the clinical psychologist. And I've handled two of such cases where patients came back to say, thank you, I'm fine. It is not there, I'm very good. And they are fine. I check up on them and they are very fine. So, oh, sorry. So this is just a picture showing how we manage. To conclude, I'll say halitosis is one of the complaints we frequently see in our dental unit and periodically affects most of the adult population. Most patients are shy to open up about their exact signs and symptoms. It's an important clinical condition with many etiologies. And although consultation and treatment may result in dramatic reduction in bad breath, patients find it difficult to sense the improvement themselves. That is why we always ask that you come with a confidant who will confirm that it's gone, and then just go by the oral hygiene instructions and you'll be fine. Thank you.
All right, thank you very much, Dr. Chris. Thank you very much. Thank you very much for such a thorough presentation. You promised us the last time you're going to teach us how to brush our teeth the right way, so you'll be doing that for us briefly. But before then, if you have any questions, please feel free to put it in the chat box in the comment section, and she will gladly answer you. Dr. Mrs. CSK Nyakun, yes, CSK Nyakun. Thank you very much, Doc, for such a thorough presentation. Thank you very much. Thank you very much. Thank you very much. Thank you very much. Now, Doc, my first question goes to now with extra oral courses. The Codicil, for example, that you are recommending, the mouth spray, is the person going to use it forever? What's your take on that?
No, no. So for the Cosado mouthwash, usually for a mouthwash, we don't use it forever. Last week, you remember I spoke about the discoloration and issues. So when we prescribe it to you, we teach you how to use it. You come for review, we check, and as soon as the issue is fine, your oral hygiene is improved. So usually you start the procedure after we have done our professional scaling and polishing. So most people just have it in their bathrooms and they use it when they have a lot of calculus in their mouth. It doesn't help. So when we do the professional scaling and polishing, sometimes it's so bad that we even have to irrigate the gums with some of these mouth. We have to irrigate with camaclus or cosodo. So after doing that, when we have it's when you are okay, you no longer have the halitosis, we advise that you stop using it for some time. Then when as you come for your 6 monthly reviews or usual checkups, if you still need it, or if whilst you come you need it, we re-prescribe it, but it's not something you should use as a chronic treatment. You don't have to keep buying for it to.
All right. So, what about chronic sinusitis? What does the ENT people do mostly for such patients?
Yeah, so usually for chronic sinusitis, what I know is they have their antibiotics for it. So we what we do is we do the oral bit and then we send to them. for them to see. So when they give them the antibiotic, there are some patients they have to actually they go in to do this minor surgery where they irrigate the sinuses and things. Sometimes some eventually I've seen a number where after every day they found a little polyp or something somewhere. When they investigated, these were malignancies developing and causing all that. So they go in to irrigate the sinuses and the patients get better with it. And sometimes if it's still there and we really can't do much about it, then it becomes a chronic something. So we teach you how to use these oral rings, the lozenges and things to mask the release of to prevent the release of the sulfur compounds, which brings the malodor to be handled.
All right. If anybody has any question, please put in the chat box in the comment section. Dr. C.S. Kenyako will gladly answer you. Thank you very much, Doc, for your time. We appreciate it. Thank you very much. But before you go, you'll be teaching us how to, scientifically brush our teeth the right way, how to put a brush and all that. You'll be doing that for us. Yeah, so in the meantime, if anybody has any question, please put in the chat box. Doc, you talked about tongue scraper. Do you have any picture of it? Something you can show us. A tongue scraper.
Let me try and get one.
Okay.
It is so most of our new brushes, the new brushes we have. Mm-hmm. I'm coming. Let me share my video. I don't know if I want to show. You come here. Okay, please can you see? So this is a toothbrush. So this is the back of the toothbrush. There are some markings on the toothbrush. Yes. Okay. So that is a part that you can use. This part. So the brushes with these markings can actually be used for scraping the tongue. Have you seen it?
Oh, okay.
So most of our new brushes now have these. So this is Colgate. This is the new Colgate brush, and it has these markings on it. And then even for our kids, they have. So when you go to the mother care, they have a typical tongue scraper. So you fix it on your tongue and then use it. It's actually a tiny brush. You just use it to scrape the tongue. But if you don't have it, you can just use the ordinary brush for it. Mm-hmm. You can use the brush to scrape it off nicely.
That is very interesting. Knowing that a dentist, she has brush all around her. Just asking a question, she just reach out for a brush. Yes, thank you very much. Now, if anybody has any question, please drop in the chat box in the comment section and she'll gladly help us. Now, someone is asking, please, I used baking soda recently to whiten my teeth. I had a sensation on my gum. I hear it removes plaques. Can this also remove bad breath, please?
So please, he or she said he had sensation on.
Yeah, so he said
sensation on.
He used baking soda recently to whiten his teeth, and he has sensation on his gum. And he knows that he's been told that the baking soda helps to remove plaques. He's asking, can it help remove bad breath as well?
No. So for the sensation on his gum, I'm very sure he did not protect his gums before doing it, and that is why we advise that you don't do it yourself at home unless we have actually given you a bleaching tray and we taught you how to use it. So you have to protect these gums. The thing is, the gums tend to hold our teeth, and so when we start giving it problems, it just pulls away from it, and eventually your teeth get mobile and they fall off because they have the supporting structures, the ligaments holding our teeth. So when you keep irritating it, you realize you lose the gum line, teeth appear longer than usual, and you lose it. So the baking soda is a little harsh, and it's part of the components we use, but we have percentages for what we use. So don't go buying, don't just buy any baking soda on the market and use. Ideally, if you want to do it at home, last week I spoke about the working bleach. We have the home bleaches we give, the percentages we give you, and you are fine. I mean, you might think you are saving a lot of money by doing it yourself at home without the expertise advice. You have to pay for consultation or something. But then when you have these problems and you come back, you pay a lot more. So let's do the right thing and prevent problems, please.
All right, thank you very much. Thank you. Now, before the next question comes, I want to ask a question. Which toothbrush, would you recommend? Is it the medium? Is it the one that is hard, soft, or medium, and why?
Okay, so we for hard brush, I don't know, I think I spoke about it last time. Hard brush, we don't need it in our mouth. The teeth is not that we don't want it. So it causes cervical abrasion. So you keep brushing and then you realize, I'm sure a lot of us have it, the gums are moving away because you constantly irritate them, and then you notice you have worn some gaps at the margins, you have some gaps there, and gradually it gets very sensitive. So as you age, you notice when you were young your teeth were not sensitive, but now when you drink cold water, it feels so odd. When you eat your orange, your acidic fruits, it feels very sensitive. Yes, it's because of what you have caused. And it's more like you cutting a tree from the base gradually. So the brush gradually cuts, and then one day you bite your favorite bread, you bite your yummy bread, and the teeth breaks. And we are seeing it. So our parents between the ages of 40 to 50 keep coming with these cracked lines and fractured teeth. They will call you. Just 3 days ago, I had to handle a similar case from cervical abrasion. So when you tell them, because it's a chronic something, they don't really see. But you just, when you open the gum line, you see some deep spaces there. So that's what the hard brush is for. What a hard brush is used for, it's actually for the corners of our floor tiles. So when you want to scrub your bath out, those corners, you can't take your big scrubbing brush. They use the hard toothbrush for those smokers and those things. Use them for those ones and don't use them for your oral cavity. The medium brush is very good. We recommend the medium brush for us not to feel we are not brushing at all, and for us not to feel we are brushing too hard. The medium brush is very good. If you use the medium brush and you brush the right way, you'll be fine. Equally, the soft brush is good. So I always tell my patients when they tell me, hey, Midi, I like the hard brush, I tell them, when you have a stain on a table and you want to clean, if you clean it with bread knife, you will have it gone in some few seconds, but you end up scraping the surface, the beauty of the table. But when you use a foam or a soft brush, you clean it gently. It takes some minutes, but it goes off and you retain the contour of your table. So that is what we want to keep. We want to have the contour of the dental papilla, the gums and things. So let's use the medium and the soft brush. And usually the soft brush, when you have some kind of gingivitis or inflammation, when you come for your professional scaling and polishing and you want to clean, you come home and you are having some mild irritation, it's very good to use the medium one so that you don't make your problems worse until you heal completely. Even after extraction, if you want to clean your mouth, just use the soft brush. So the soft brushes help in that sense. And then when you are fine, you use the medium. The hard is no for our mouth to use.
All right, thank you very much. There's a question which is how regular should one visit the dentist for normal checkup?
So I think I have mentioned it a number of times. It's 6 monthly, so every 6 months. But for you not to forget, or for it, do it as you at least once a year, a birthday gift to yourself. For that one, you remember, hey, my birthday is getting close. A week before that, Charlie, let me clean my mouth and then do some FVCs and things to see if everything is fine. Then you move on.
Okay. Now there's a question. The person says tooth extraction or RCT. Which of them will you recommend in an attempt to treat both to treat tooth decay and halitosis?
Okay, so for halitosis emanating from a cavity, RCT and tooth extraction are usually all. So I'm a restorative specialist, so I will always go in for RCT. We have certain recommendations before we consider a tooth ideal for RCT. So we don't just do RCT for any tooth. Yes, the last wisdom teeth, we usually don't do RCTs on them. When you come and it's badly broken down, you don't have it. So sometimes it's just a small cavity, but it's gone so deep, but you still have the tooth structure. The main idea is maintaining the tooth structure. You don't want to lose the tooth. And it is very expensive to replace a missing tooth. And as soon as last week, I showed you a picture of how one looks without teeth and how one looks with teeth. The same person would look so old. So you don't want to lose a tooth. And now an implant to replace, which is the most comfortable way of replacing a missing tooth, is from $1,500 to $2,000. If you want to get a bridge is now going from 6,000 cedis, 9,000, 2,000, 15,000. And then the dentures, which most of us don't like, even that is very expensive, 500 cedis and over. So why do you want to lose? Why do you want to sell your comfort for that? If you can save the tooth, if the least possibility to save the tooth, please do. So that is why we go all out to explain RCT to you. If you cannot save it at all, if you are not an ideal candidate for RCT, no dentist will advise you to have it. But if you can save the tooth, please do the RCT and crown the tooth. It is very good.
Please, what is RCT?
RCT is root canal therapy. It's root canal therapy. So if you have the cavity spreading to, if the caca, the caries, the decay is spreading beyond what you see in your mouth, yes, then so usually the symptoms is you have sleepless nights. So around 2 a.m. to 3 a.m., it wakes you up and it hurts so badly. Sometimes you can't even pinpoint the tooth causing it. It gives you ear pain, severe headache, and then sometimes around 5, it stops and you sleep. Then early in the morning, it starts paining you again. You don't have to eat to have pain from the tooth. So while sitting in the office, it starts hurting you. You notice a swelling, and that is when you've crossed the filling area. We won't just fill the tooth. We have to do RCT before we fill the tooth. Usually after RCT, we crown the tooth. So most people run away from the RCT because of the crowning. Yes, we have to crown the tooth to protect it. So RCT is just maintaining the structure of the tooth. But it gets the tooth becomes a little soft. So we put the crown on to make it very okay for you to chew and enjoy your meal.
Thank you very much. From what you said so far, I have defaulted on my dentist appointment. I have to start making an arrangement for my dentist appointment shortly, soon, somewhere around next week. Yes, thank you very much. All right, there's a question. Doctor, please, charcoal, plantain stem mixed, used to clean teeth and tongue in my childhood by my grandma was so refreshing. It was so refreshing. Was this exercise helping to control odor in the mouth as a local method? What local alternative do you suggest now for both teeth cleaning and control of odor?
So the the halitosis we spoke about isn't something that is always there. Please, I want us to get it. It's not like everyone has halitosis. It is a pathological halitosis. It is something that you need to treat. So you don't just sit up and this is what I do to control my halitosis. No. In general, you have to keep very oral hygiene. And for the good oral hygiene, that is what I spoke earlier on. The plantain and charcoal, I have used some before. It's very good. But now what we've noticed is usually because when we use them, they don't have these bristles to clean the interdental spaces. So you don't get the interdental spaces clean. And you still have food debris stuck in between the teeth. So if you can do it in the evening and then floss and probably do your brushing in the morning. You combine it, it's fine.
All right, thank you very much. So when you talk about interdental space, that you're talking about the spaces in between the teeth, right? Yeah, hello. Okay, sorry, you went off briefly. Welcome back. Let's get you unmuted. All right, thank you. Welcome. Yes, I was asking, interdental spaces
Sorry.
that you're referring to, does that mean spaces in between the teeth, right?
Yes, please. Yes, please.
Okay, all right. Um, just before we go to any other, if you have any question, please feel free, drop it in the chat box in the comment section, and Dr. Sawabuating will gladly answer us. All right, my question is this: how do we brush our teeth correctly? If you can go over that with us correctly, how is it supposed to be done, please?
So I wanted to get the model to teach this, but I haven't resumed yet. And I will send you a video to
Okay.
put it up for
Okay.
on your page
Yes.
for
All
everyone
right.
to watch. But
Okay.
I will just go through it with, I have a toothbrush here. So I'll quickly go through it with my mouth for you to see. So the song is brush in circles, brush in circles. So the brushing in circles is the labial side. So brush in circles, brush in circles. So you go the circular motion, not this way. What we ordinarily, then 5 minutes we wash our mouth and we go. So brush in circles, brush in circles. Then you start flicking. Hey, 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 hey. You flick the inner surfaces. That is how you clean them. So you just keep flicking. So then you scrub the chewing surfaces. So where you chew from, you scrub it. And so that's where you do the scrubbing. Scrub the chewing surface, scrub the chewing surface. Then you clean your tongue, clean your tongue, clean your tongue. Then you clean your tongue. So it's a common song we teach almost all the kids we meet. We go to schools and we teach them. So we can go through it. Brush in circles, brush in circles, flip, 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 flip. Scrub their chewing surface, scrub their chewing surface, clean your tongue, clean your tongue. Then we end it by saying, then you are clean, then you are clean. Then
All right. All
we have
right.
another one in Ghana, which isn't basically how to brush, but it says be shoulder, back and shoulder. So when you wake up in the morning, you brush your teeth. And then when you're going to sleep at night, you brush your teeth. Then you continue shoulder, shoulder. So you can teach your child if you're a Ghana, and they will have it then. And for my kids, I always sing the brushing circles to them. So when you get to clean your tongue and you forget to do, mommy, clean your tongue, then you move on. So I'll get the video, send it to you so that you can put it up.
Thank you. I'll be waiting for that. Thank you very much. Now, somebody is asking, what is the effect of cola nuts on your teeth?
Cola, please, I haven't researched much into that, but I know those who take a lot of these cola nuts have some specific stains on their teeth, and they would usually come in for cleaning, especially our Muslim brothers, our matured fathers. They tend to chew it a lot with their tea. They have attire, they call it attire. They have this caffeine tea they take too. So, but I don't know what it does. So I'll check it out. I haven't read much.
All right. So somebody is also asking again, just for clarity. You specified it about earlier, but she just want clarity. She said she joined late. She's asking, what is the effect of baking soda on our teeth? Just a brief summary of it again to everybody's hearing.
Yeah, so for earlier on, I spoke about the fact that people use it to bleach. But we have certain concentrations we use in the dental setting for bleaching. It's quite harsh. So if you go in for any baking soda for your mouth, you cause a lot of problems for yourself. So you can go in for a dental checkup. We give you the reagent, we give you a bleaching tray, we teach you how to use it. We teach you what to use to protect the gums, and then you are good to go. Okay. So
All right.
don't just get any baking soda and don't just use any baking soda on the market.
All right. Thank you very much. Thank you very much. We appreciate the
And
live demonstration of how to brush our teeth the correct way. We actually appreciate it. You use yourself as a model. That means a lot to us. We appreciate it. Thank you very much. Yes. So please, you were saying something.
and when it comes to toothbrushing, the most important thing we need in the paste is fluoride. So if you just use the baking soda to brush your teeth and you don't go in for your toothpaste, it means you are lacking the fluoride, and that doesn't help with us. So that is the most important thing we need. So don't say me, I use baking soda, so I'm fine. Baking soda is just a little percentage we need. We need fluoride, and that is what we need. So anytime you buy toothpaste, make sure it contains fluoride.
All right. So what doctor is saying, it's obvious. A lot of people use baking soda to whiten their teeth. It's obvious. So what she's saying is, even at the dental clinic, they use a percentage of it, not what you get to buy from the market. That is why you need to go see the dentist to get to the right percentage. And not only that, they use other things in addition. So using that alone is not the best because it has some negative effect on you when you just use baking soda. This is for Mr. Tonyenyo, who is asking her to come again. Yes, she said the best is to go see the experts to tell you or to show you the percentage of it that they use. What you may buy from the market may not be the right percentage. That's what she's trying to say. And also, with our toothpaste, she said there's the need for it to have fluoride as well. Thank you very much. Thank you very much. If there's any last question before we allow Dr. C.S.K. Nyaku to go, please put it in the comment section in the chat box. And for our friends who are joining us here for the first time, welcome. We appreciate you all. We have a lot of people joining us from New York and all the other places. We appreciate you. Please take 3 seconds to subscribe to the YouTube channel. And all those who have subscribed to the YouTube channel, just put the notifications button on. And anytime we go on live, you will be notified to join us. And it's easier that way. Also, we always have the recording uploaded on our YouTube channel so that when you miss it, you can always go back and listen to the whole presentation again. We do this, we need your help to share it and share the link with a lot more people to subscribe and watch the videos to help them because there's too much misinformation out there, and this is helping to bring experts in the field so we can reduce the level of misinformation out there on social media. We need your help. Subscribe, have your friends subscribe. There are a lot of topics we have discussed already in the past. Lot and lot of topics. Over 30 videos are there currently, so you can go through them. These days, when someone asks me any medical question, I just go through the videos and I send you the link. You watch it, and then we'll continue discussions because every information is already provided there. All right, thank you very much, everyone, for joining us. I'll just ask Dr. C.S.K. Nyako to please give us your final words on the topic.
Okay, so what I want to say is one thing I've seen in this profession with patients with bad breath is they are very shy to open up, and they feel most often they feel they are the only people with it and they don't want to talk about it. But the dentist is your friend. We have seen a lot of cases. Our nostrils are designed for it. We want to smell it. Come to us, talk to us about it. Feel free. Nobody will look down on you because you have halitosis. It is not one person's thing. So just come to us and let us know. And let's help you. It's better for you to seek help now than to live lonely with it and just have issues, mental health issues. Okay, so come to us and let us help you.
Yes, thank you very much. Halitosis affects your self-esteem. It has a lot of effect on you, mental health-wise. She's very right. So, like we are always advocating, we're not here to treat all the conditions. We are here to let you know what the problems are, what could be causing it, so that to whet your appetite to go seeking expert advice. Go to the hospitals, go to the clinic, speak to your doctor, speak to your health professionals, and there is always help. There is always a solution for any problem that you might be going through. So if you have halitosis, there's nothing wrong with it. You have it. Somebody also has something else. Somebody also has something else. Just go to the right place and assistance is available. Last week, Dr. C.S. Kinyako told us that contrary to what most of us believe, the dental clinic is not as packed or as heavy. They are always available, and there is enough staff to help anybody who walks through. I think you just need a. Do you need a referral to come to Kolebu Dental Clinic, please?
No, you don't need a referral to come to us. It's walk-in. All what you need is, if you don't have a health insurance will help you save a lot, like from your folder and a few treatments. So it cuts down the cost. But you just come with your health insurance. If you don't have it, you can still walk in. We'll sort you out. You don't need a referral to see us.
That is great. So you don't need a referral to go see the dentist in Kolebu. Just walk in. If you have insurance, come. If you don't have insurance, still come. And they are there in their numbers to help you. Thank you very much, Dr. C.S. Kinyaku. We appreciate you so much for making time, especially using yourself as a model to teach us and show us how to brush. I don't think I'll forget. I won't forget it again. Trust me, I have to be frank with you. I've never known that brush in circles. Trust me, I've just learned it. I'll have to now start practicing. Please, if you're on this call and you are like me, and you also didn't know that brush in circles, please type me in the chat box so that I know if anybody else also has that problem. Now, there's a question I missed. Does the premolars of a child come out? Hey, let me see.
Hey.
If the premolars of a child come out, would you recommend RCT for a child? It's our final question. I nearly missed it. Thank you very much for reminding me.
Okay, so to start, kids don't have premolars. Mm-hmm. Kids don't have premolars. So what they do have is they have the incisors, the canine, and then molars. They don't have premolars. Their molars are replaced by the premolars we have in our mouth. So their molars are replaced by it. Then the adult molars start behind as the three huge ones we have in our mouth. But kids don't have premolars. And then for kids, it depends on the tooth involved. So at around 7, they have the adult teeth. And if it has an issue, we have pedodontists. So we have a lot of assessments we do before we do RCT on those teeth for them. But what we do for kids are pulpotomy and pulpectomy. So their treatment is different from the adults. That is why we train a few dentists as pedodontists to actually see them. So we do pulpotomy and pulpectomy for them. The thing is, we don't want to take their teeth out earlier than it would have fallen out, because as the tooth falls out, it gets replaced by another teeth. Do you understand? Another one replaces it. So another tooth. So when you take it out before its time, and it's not like the one in front comes, then the one at the back. Some of those at the back comes before some of those in front. So the arrangement is not in order. So if you take it out and you leave the space there, those at the back would cause some sort of drifting to close the space. And that is why some adults have some teeth inside. They have some malposition, some at the back. Some, when they lift their lip, you see a tooth appearing here because there was no space for it to come in line because of something their parents, some extraction they had in their. So usually, if we have to take the tooth out, we can't do much to save the tooth. We give them what we call the space maintenance. It is a space, we give them space maintenance. We have a lot of them. So there are some kids, you see something in their mouth, just a simple space maintainer, maintaining that space until the adult one erupts through. Yes, so kids don't have premolars. What they have are molars. And as much as we can, the premolars come in around 9 years, 8 years. So if they have cavities in their molars and you have to take them out, and you can save it by doing pulpotomy. So the pulpotomy is just like the adult RCT, which will maintain the baby tooth until it falls out on its own. But if we can't do it, you come to the dentist and it's badly broken down and they can't do much. We take it out and we give you a space maintainer to maintain that space until the adult teeth erupts through. So that if we don't do all these things and we just take them out and we leave them out like that, the patient has a lot of aligned teeth, malocclusion, and they grow up and they'll have to pay a lot for braces to rearrange them, and Invisalign to rearrange them. So these are the measures we take to prevent these things.
All right, thank you very much for that deep lecture on pediatric dentistry. Thank you very much. And I hope by that everybody else's question has been answered. We appreciate your time. Once again, those who have not subscribed yet to the YouTube channel, please take 3 seconds and do so. And those of us who have done so, kindly put the notifications button on. And please, when you are less busy, just go through the videos that has already been uploaded and just let's all learn together. And feel free when you learn and there's something very important for a friend, share that recording, share that link to a friend as well to also benefit from as we go in, week out to try and educate more of the public. Thank you very much, Dr. CSK Nyakum, for making time once again. We appreciate you. Once again, every one of you, thank you very much for coming.